Welcome back to another episode of Preserve Health Talks. I'm your host, Dr. Ira Pearlstein, and today we're beginning a new series on sexual health, a subject that affects nearly every adult, but remains one of the least openly discussed parts of healthcare. Sexual health is not just about performance. It's about connection, desire, identity, aging, communication, expectations, and sometimes and often disappointment. In this series, we're going to approach these topics honestly, clinically, and thoughtfully, without sensationalism, without pornography, and without avoidance of these topics either. Joining me is Ann Kator, a marriage and family therapist and sex therapist, practices out of Chicago, Illinois. She works with individuals and couples navigating desire discrepancies, sexual dysfunction, compulsive behaviors, and evolving sexual identity throughout the lifespan. Good morning, Ann.
Hi, Ira.
And welcome to our show.
Thanks. Thanks
Great.
for having me.
Yeah.
I'd
Preserve
love
Health
to talk
Talks is
about
fun.
sex.
Yeah, we're going to talk a lot about sex.
Okay, good.
So what led you into sex therapy?
Well, I was a therapist in private practice, and I joined a woman named Phyllis Levy in Chicago, who at the time was a very well-known, famous, I must say, sex therapist. And this was in 1985, long time ago. And no one was talking about sex except Phyllis. And we had a radio show, a syndicated radio show on WLS in Chicago, went across the country for 5 years, from 1985 to 1989. She was my mentor. She was a certified sex therapist and talking about sex openly, and wow, nobody else was. We were on the radio for 5 years and with another partner who runs the men's center. And it was wild. It was wild.
I bet it was. So that led you into it. And how would you distinguish sex therapy from general psychotherapy? What do you do that's different?
So sex therapy focuses not really on sex. Let's talk about couples, because
Okay.
what we do a lot of is in the context of a marriage and family therapy, we will sex will come up, and so it's really couples counseling that we do. And if we don't talk about sex, we're missing a huge chunk of that couples relationship. And believe it or not, I have had many marriage therapists over the years who have referred couples to me because they were uncomfortable talking about sex. That always amazed me, because I don't know how you can counsel couples without talking about sex. They will talk around it, they'll talk about money, they'll talk about communication, they'll talk about the in-laws, they won't talk about sex. So that remains like the elephant in the room.
So physicians like myself, what questions do you wish
Whoa.
we were more comfortable asking our
I
patients?
tell you, the best doctors I know, and we work with a wide network of doctors who refer to us a lot in Chicago, and those are the doctors who dare to ask their patients, so, how you doing? How's your husband? How are the kids? What's happening? And, doctors these days are quite rushed. It's kind of a different climate. We had the luxury of practicing in the 90s and the early 2000s when doctors had a little more time with patients. The really good ones dared to ask their clients, how are you? What's going on? And boy, would they hear what was going on.
Yeah, I use a little bit different approach as a concierge doctor because I'm able to spend a lot more time with my patients.
Right.
And you don't want to open up a conversation, are you depressed? Or have you ever been depressed? That's what a downer for the beginning of an office visit.
Yeah,
So I've kind of flipped that a little bit.
that's good.
And I'll walk in the room, and one of the first questions I'll ask is, so what are you doing for fun? And if someone says, I don't ever have fun, I'm not doing anything for fun, then I go a little bit deeper because I realize we've probably got a little bit of a problem there. But as it pertains to sexual health, what are we missing?
So that's hard to bring up. So how are you and your husband getting along? A lot of times family practitioners know these families for a long time. Over years, they may see their kids, their sister, sister-in-law, and if they may see the husband and the wife separately, so they can say, how are things going? How's Bob? And getting into, not many of them will say, how's sex? How's the sex life going? They won't do that. They say, how are you guys doing? And a lot of times you'll get sudden crying from somebody who says things are really horrible, or my son's in jail, or, my husband wants to leave me, or they'll bring up infidelity. So really just a gentle probe about how you're doing and how's Bob is often all you need. We don't need, I don't get referral, I do get a few referrals specifically for sex therapy, but really I get referrals from doctors for relationship counseling, for marriage counseling. And that's when we then get into the sexual part of it.
So how would you describe then, Anne, your philosophy when working with couples around intimacy?
So for me, intimacy is not physical, just physical intimacy. My couples don't have verbal intimacy. They're not good at verbal intimacy. No one helps us with that. We don't know how to, I hate the term communicate. We don't know how to communicate, but verbal intimacy to me is hugely important in a relationship. And that requires trust and being vulnerable and being really very open with your partner. And that sets the stage for physical intimacy. So first, I don't talk about physical intimacy. I help the couple build a relationship foundation. They can't even talk about sex, my couples. So many of them. They don't know if their wife orgasms. They don't know about fantasies that their husband, they know nothing about each other because it's like there's a lot of shame. There's a lot of early religious training. We don't talk about it. We don't enjoy it. So we first start with the fundamentals. Let's talk about sex. And you will, when you just say, let's just talk about sex, you wouldn't believe what you hear. It is astounding. I am astounded at how little we know about each other and how little we know about arousal and pleasure. And so about each other, we don't know enough.
So, what I'm hearing in my practice from guys is, I don't have enough intimacy. They don't use that term,
No,
actually.
they say,
I don't have enough.
I don't get laid enough.
I don't get laid enough. and women are saying all he wants to do is have sex. So it creates the elephant in the room. How do you address initially and get through that elephant in the room?
And so that gets into what we call desire discrepancy or libido differences. But what I find is, you're right. I have so many couples who come in and the guy's complaint is, I want more sex. And the woman kind of rolls her eyes and she says, you know what? I want more help with the kids. I'll never forget one woman who told me both of the couple were working and they had 3 little kids. She was exhausted, stressed. And she said, you know what? And he was complaining he didn't have enough sex. And she said to me, you know what would be foreplay for me, Anne? If you folded the laundry. I'll never forget that. It was just so right on. So, and women do require, or we want more of an emotional connection. We want more verbal intimacy. We want our husbands to notice us, to talk about us, to say, how are you doing? What's going on? And not a lot of us get that. That, again, our husbands just want to get into, have sex, some of them. And we want that emotional connection. We want the touching, the affection. I can't tell you how many, dear Abby will tell you this, all women want to get in bed and cuddle. They just want the touching. They want the affection. And what do guys want? Not that.
Okay. So social media, has it helped us? Or has it hurt us when it comes to normalcy of sex? Because the way I was trained is there is no normal. What's normal is what's normal for that couple. But people now are focused on, they say it's normal to have sex 3 times a week, 4 times a week, 1 time a month, never, often, frequently. Is there a normal? Isn't there a normal? And
are you asking about frequency of sex or normal sex? So frequency of sex, it's whatever works for the couple. And
Okay.
we call that, everyone thinks everyone else is having more sex than them.
Mm-hmm.
We call that compare and despair. My neighbor has this great new car, why don't I? It's compare and despair. So what normal is whatever works for you and your partner. There are often discrepancies, and those have to be negotiated out, just like everything else in a marriage. A marriage is a small business. It requires lots of negotiation. Sex is one of those. If your husband has a higher libido than you do, we got to figure that out. It's a negotiation. There is no such thing as normal when it comes to frequency of sex. It's, again, whatever works, whatever you can work out together that works. If you want more sex, Ira, than your wife, maybe you incorporate masturbation into your sex play. There are all kinds of ways we can work around it. In terms of, if you're asking about, is there normal versus abnormal sex? Well, that's a whole different topic. I'm not sure we want to get into right now, but
Well, that's another show, and
that's
this is going to
another
be a
show.
7-part series.
That's good.
So, do you think men and women experience desire differently, or is that a gross oversimplification?
In terms of desire, it's our timing is bad. Our timing is so off. Men reach their sexual peak when? Between like 18 and 25, and they're raring to go at any moment. We, women, reach our sexual peak much later, like 35, 42, or 3. So there's a timing issue there, number one. And desire, we all, most of us have sexual desire or think about sex or want to have sex, but we do it differently.
Well, is sexual desire something that should feel spontaneous, or is that just a myth?
So when we're younger, we can feel arousal, like at the drop of a hat. The wind can blow and you can get an erection, right? Women, especially around the time of ovulation, we can feel like very desirous. But, desire is something that, it's not really desire to me, it's arousal and it's pleasure is more than desire. Is that what I'm not sure what you're asking. What's sexual desire?
Yeah.
That's exactly, okay.
That's exactly what I'm
Okay,
asking.
good.
Okay. So do you think pornography has changed what patients expect from themselves or their partners?
So pornography is a huge problem that we have been seeing in the last 20 years. We used to get lots of, magazines and catalogs in my office, and I realized, because I treat a lot of sex addictions, we couldn't have, like Sports Illustrated with the swimsuits, and we couldn't have catalogs that had women in bathing suits, because men were, their neurocircuitry is being changed by watching pornography. So it is a huge problem. It changes expectations. It changes what they want in bed with their wives. It creates a lot of compulsive sexual behaviors, which are unwanted, and gets a lot of men into trouble. So,
But here again, that could be resolved with, and it's probably a lack of, but it could be resolved with more open communication about what the partner wants.
well, yes, okay, but you're right. I was talking about, I segued into sexual addiction,
Okay.
which is compulsive sexual behavior. But
I'll bring you back.
bring me back.
Okay.
So absolutely, if we could talk openly about what I want and what you want, which may be very different things, and we can do it without shame and without defensiveness, we're on the way to a healthier relationship.
How hard is that to achieve for
Very hard.
the couples you counsel? That takes time.
It takes a lot of time. First of all, a lot of us have a lot of shame about sex. So much shame. Many more women than you think have suffered sexual trauma as children or young adults, date rape in college. That impacts how open we are about sex, and it definitely affects how sexual we feel with our partner. So yes, talking is essential, but there's so much shame around it. There's so many inhibitions, sexual inhibitions. Men are often afraid to tell their wives what they really want. You know, he doesn't want to say, I fantasize about having anal sex, because he's afraid she would freak out, and she just might. So they don't talk about it, and he just kind of stews until he gets into my office.
So at what point does a sexual interest, you had mentioned anal sex, but any sexual interest that might be somewhat variant, become a problem rather than simply a variation? Fair question?
Okay, when
Okay.
does it become an interest instead of a problem? You know, if both of the couple is able to explore, wants to explore, doing new things or bringing sex toys to bed, or even bringing another person to bed, if both of them are interested in doing that, and then it can work. But if one person wants it and the other one is absolutely vehemently opposed to that, that's a problem.
Okay, last question for you in this first episode.
Yes, dear.
As we launch this series, and we're going to talk about sexual frequency, desire discrepancy, techniques to improve intimacy, erectile dysfunction, performance anxiety, female sexual dysfunction, pornography, compulsion,
Well,
and digital sexuality, deviant sexual behavior, although some people say there is no deviant sexual behavior, hormones versus psychology, and aging and sexual health as we go through this series. But as we continue to go through it, what would you want most of our listeners to understand about sexual health that often gets overlooked?
I would want them to know that we have to start talking about sex openly. We have to try to lose that cloak of shame that we have, that we're not doing it right, we're not getting it enough, I'm not attractive. We have to talk to our partners. I'm talking about partnered sex now. There are many people, who are unpartnered, but with partnered sex, which is what I focus on mostly, I want them to start talking.
And by partner, you mean long-term partners.
Yeah, someone you're dating for a long time, a wife, a boyfriend, girlfriend, yes. Unpartnered sex is really quite a different subject.
Okay. And we'll get more into that, but thank you for joining us
You're
for this
quite
first
welcome.
episode. We're going to do several more episodes.
That's a tall order right there, honey.
It is a tall order, but we can't wait to have you back. Thank you for watching another episode of Preserve Health Talks. We'll see you in our next show.